Hi, my name is Ovokere Ado. I'm a doctoral student with the School of Applied Sciences, the Department of Health, Exercise Science and Recreation Management at the University of Mississippi. Today, my mentor Dr. Paul Luprinzi and myself are excited to share with you our findings on a recent study that is built for publication in an upcoming issue of the Mayo Clinic Proceedings. In our study, we examine the predictive validity of the American College of Cardiology and American Heart Association pooled cohort equation in predicting all-cause and cardiovascular disease specific mortality in national prospective cohort study of adults in the United States. The pooled cohort equation developed by the American College of Cardiology and American Heart Association Joint Task Force on Practice Guidelines is used for the assessment of an individual's 10-year risk of a first atherosclerotic cardiovascular disease event. This is for individuals who ab initio are free of cardiovascular disease primarily between the ages of 40 and 79. Variables included in this equation include the individual's age, race, ethnicity, gender, treated or untreated systolic blood pressure, diabetes and smoking status, as well as total and high density lipoprotein cholesterol levels. Scores typically range from 1 to 30%, with individuals with a score of greater than or equal to 7.5% classified as being at an elevated risk, and individuals with a score of greater than or equal to 20% classified as being at a high risk. For our study, we examined the predictive validity of these equations in ascertaining an individual's all-cause and cardiovascular disease specific mortality risk. In order to do this, 11,171 cardiovascular disease-free adults who participated in the National Health and Nutrition Examination Survey between 1999 to 2010, between the ages of 40 to 79, were followed through to December 31 of 2011 using the National Death Index probabilistic algorithm to ascertain the cardiovascular disease mortality and all-cause mortality status. Our findings were as follows. For every 1% increase in PCR or pooled cohort risk equation score, there was an associated 3% increase in all-cause and cardiovascular disease specific mortality risk. These findings are as displayed in Table 1. Additionally, individuals who had a PCR score at baseline of greater than or equal to 7.5% when compared to individuals with a PCR score of less than 7.5% had a 77% increase in all-cause mortality risk, as well as a threefold increase in cardiovascular disease specific mortality risk. Also, the Kaplan-Meier survival curve paints a similar picture, with individuals who have a PCR score of less than 7.5% shown to be at an improved probability of survival in the follow-up period when compared to individuals who at baseline had a PCR score of greater than or equal to 7.5%. Findings were similar when using the 20% cut point. When put together, our findings lend some supportive evidence as to the predictive validity of the pooled cohort equations risk assessment score in predicting all-cause and cardiovascular disease-specific mortality risk. These findings also buttress the importance of controlling modifiable risk factors such as an individual's high density and lipoprotein levels, individuals' diabetes and smoking status, and other modifiable risk factors assessed in the PCR score in a bid to improving survival related to cardiovascular disease. For more details, please click on the link associated with this presentation. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.